here for a COVID-19 update. I am joined today by Health Commissioner Dr. Terraza, Deputy Health Commissioner Tan for Aging and Care Services at the Health Department, Ryan Moran from MedStar Health's Director of Community Health, Rebecca Altman, LifeBridge Health's Vice President and Chief Integration Officer, Katie O'Connor, Operations Chief and Co-Chair of the Vaccine Equity for the Unified Command at Johns Hopkins Medicine, Michelle Patch, Assistant Professor and Director, Johns Hopkins School of Nursing Vaccine Vouchers Program, and our Police Commissioner, Michael Harrison. Thank you for joining us. As of today, February 8th, 2021, our city has had 38,008 reported cases of COVID-19. We have 380 people hospitalized with COVID-19. Our ICU utilization is at 87%. Our acute care utilization is at 86%. And we are now, unfortunately, at 749 deaths from COVID-19 in Baltimore City. I am proud to say that we are still seeing a downward trend in COVID cases here in Baltimore. Our positivity rate down 53% over the last 4 weeks. Our metrics remain in a good place, and we are cautiously optimistic about where we stand. I want to again thank everyone in Baltimore who stayed home to watch the Super Bowl. Although we didn't get the result we want, with the exception of Shaquille Barrett and 2 other Baltimore young men winning Super Bowl rings. But thank you for staying home, because we know that will help us stay in a downward trend. We will continue to closely monitor the data and make decisions guided by the data and public health experts. Today, I stand here today with Dr. Terraza and our local healthcare partners to announce a new mobile vaccination and outreach strategy targeting older adults here in Baltimore. We know it is critical that equity remains at the forefront of our vaccination strategy. This includes taking special care to ensure that older adults and our Black and brown communities who are most susceptible to the virus and the least likely to have access to the internet and transportation can be vaccinated. I am extremely grateful to MedStar Health, LifeBridge Health, and Johns Hopkins for partnering with the City of Baltimore to ensure a more equitable distribution of the vaccine. I would like to turn it over to Dr. Terraza for further comment. Dr. Terraza?
Good afternoon, and thank you, Mayor Scott, for your leadership during this pandemic. Today, standing with many of the leading healthcare organizations in Baltimore City, including MedStar Health, LifeBridge Health, and both Johns Hopkins Medicine and the Johns Hopkins School of Nursing, I'm excited to announce the rollout of the coronavirus mobile vaccination clinics. Although they could not be here to join us, I'd also like to acknowledge and thank Safeway and Rite Aid, our pharmacy partners who are also assisting with this collaboration. These mobile clinics are designed to bring education and clinical support to eligible Baltimore City older adults for whom transportation or mobility issues might make it difficult to travel to a centralized mass vaccination location. With the help of our healthcare partners, older adults in many Baltimore City independent and assisted living facilities, nursing homes, as well as those experiencing homelessness and living with disability, can look forward to receiving the coronavirus vaccine directly where they live in the weeks to come. Informed by our experience of hosting dozens of mobile COVID-19 testing sites and dozens of pop-up flu vaccination clinics over the course of last year, our mobile coronavirus vaccination clinics will focus on residents who are at greatest risk for negative health outcomes as a result of COVID, starting with a focus on senior housing sites. We also have plans to visit a number of independent living facilities, assisted living facilities, and nursing homes over 2 months that may not have been covered by the federal pharmacy partnership. The Baltimore City Health Department will follow the Maryland Department of Health, their vaccination guidance, prioritizing congregate living spaces with the highest density of older residents aged 65 and up. Our prioritization criteria for mobile vaccination clinics will also take into account recent COVID-19 outbreaks and prioritize neighborhoods where we know vaccination rates are low. Per Maryland Department of Health guidance, the staff at these residential facilities during our clinic visits will also be eligible for vaccination. Our experience with the flu vaccination clinics late last year taught us that outreach before a mobile clinic is paramount to success. To ensure our residents at these facilities and buildings are aware of the opportunity to receive a vaccination where they live, our community health workers will visit these sites days or weeks before our scheduled clinic to help residents register for appointments. Community health workers are trusted members of the community that have already established relationships with the coordinators of many housing sites that we will be visiting throughout the next few months. During these pre-registration visits, residents will also have the opportunity to engage with our staff and ask questions about the vaccine. As mentioned last week, while our vaccine supply remains low, we will currently be able to vaccinate approximately 50 to 100 residents per mobile vaccination clinic during one visit. However, over time and with more vaccine supply becoming available, we will eventually be able to support multiple vaccination teams at the same time, with a goal by midsummer of supporting 20 mobile teams in the field at once. Though this may sound like a small quantity in comparison to our mass vaccination sites, the net impact of focusing our limited resources on the highest risk groups with limited to no access to sign up online for an appointment, or those with the inability to travel to a mass vaccination site cannot be overstated. We know that there have been challenges with distribution so far and have urged patience for concerned residents as we and our partners are working tirelessly to create non-internet-based methods of appointments and create opportunities for those residents with mobility or transportation concerns so that they can still receive their vaccines. Today, we hope that some of our older residents and their concerned caretakers can begin to feel some sense of relief. The health department and our partners will be coming to you to provide vaccines in the weeks and months to come. Thank you.
Thank you, Dr. Duraza. I would like to now ask invite each of our healthcare partners to say a few words. We'll start with you, Ryan, and just go down the line with everyone and just introduce yourselves as you come up. Thank you very much.
Good afternoon, everybody. My name is Ryan Moran, and I'm the Director of Community Health for Baltimore City for MedStar Health. And first off, I want to thank Mayor Scott and Health Commissioner Dr. Duraza for your courageous and your bold action to ensure that we reach the most vulnerable residents of our city. Like the mayor said, equity must be central to our response to eradicate COVID-19 from our communities. This response must include an intentional approach to remove all the barriers that stand in the way for people to receive vaccination. In partnership with the Baltimore City Health Department, MedStar Health has activated a two-pronged approach to reach our most at-risk, vulnerable older adults in Baltimore City. The first approach is standing right behind me, and that's the MedStar Health Mobile Health Center. We launched this approach at the end of January in Cherry Hill, at the Cherry Hill Senior Manor, where more than 60 residents were vaccinated. There are 2 exam rooms on this mobile center, and the unit is also equipped with a lift to serve those with varying mobility, limitations, and disabilities. The Mobile Health Center is slated to be at 2 other senior and low-income housing facilities in South Baltimore this week. The other approach that our health system has activated is sending a clinical team with supplies on site at facilities as well as community-based organizations. Last week, teams were on site at J. Van Story Branch and Shepherd's Clinic and vaccinated 170 older adults. Teams are mobilized this week and are slated to reach up to 100 residents at Gedco's senior housing facilities. The approach's efficacy is improved by advanced on-site vaccine education to address vaccine hesitancy. MedStar Health is proud to partner with the Baltimore City Health Department to ensure that our pandemic response, this life-saving shot, reaches people exactly where they are. Thank you.
Good afternoon. I'd like to thank the Mayor Scott and Dr. Duraza for inviting us here today. I'm Rebecca Altman, Vice President and Chief Integration Officer for the LifeBridge Health System. We are so proud to join with the City of Baltimore and our fellow health partners in this important initiative to bring COVID-19 vaccines into our communities. We are also excited to be launching our new LifeBridge Health Care Happens Here mobile unit at this time. This new mobile resource allows us to bring more of our healthcare services, including vaccinations, directly to the residents we serve. The program builds on a pilot project we held over the summer following the onset of the pandemic. We took 2 employee shuttles and turned them into mobile units to bring healthcare providers into the community for COVID-19 testing to our most vulnerable and needy population. Those initial units made more than 315 patient visits during the 6-week period of time. Our teams are doing a final installation of the new equipment in the van this week, and early next week, the new LifeBridge Health Care Happens Here mobile unit should be ready to roll out. We are so pleased that the timing coincides with this coordinated vaccination initiative to help older adults in eligible priority populations and groups who have mobility issues, transportation challenges, and who are most vulnerable to get the vaccine. Our first mobile vaccine clinic will be focused on senior living facilities in West Baltimore, near Grace Medical Center. We are targeting February 19th to begin the mobile vaccine clinic in identified facilities, Harlem Gardens and Chase House. Our teams have always been proactive in our community-focused approach to caring, and the COVID-19 pandemic has certainly caused us all to dig deeper in finding new ways to care bravely and make positive impact on the health of our communities. We look forward to continuing our work with the city and with our clinical partners in this exciting new vaccine initiative. Thank you.
Hi, I'm Dr. Katie O'Connor with Johns Hopkins Medicine and co-chair of our Vaccine Equity Task Force. I'd like to thank Mayor Scott and Dr. DeRaza for their overwhelming commitment and tireless efforts for our city and for the vaccine equity that we would like to deliver to our community. We at Johns Hopkins Medicine are honored and thrilled to be part of this opportunity. We will be collaborating across the city with our health system, with our university, our schools of nursing, medicine, and public health to provide comprehensive vaccination clinics on site at senior housing locations, as well as mobile teams into the community to echo what Ryan Moran said, to meet our community where they are. We again are thrilled for this opportunity and the opportunity to partner with Mayor Scott and Dr. DeRaza in supporting our most vulnerable residents of this city, our Black and brown residents who deserve the equity for this vaccine across the city. Thank you very much, and I'd like to introduce Dr. Michelle Patch, who can provide information on our School of Nursing's efforts.
Thank you so much, Dr. O'Connor. Hi, everyone. I'm Michelle Patch. I'm an assistant professor at Johns Hopkins School of Nursing, and I'm helping to direct our efforts in our vaccine volunteer group. I just want to echo what everyone else has said today. We're truly grateful for the opportunity to partner with Baltimore City and our other clinical groups to help to bring equitable distribution of this vaccine to Baltimore City residents, particularly those most vulnerable and with most difficulty to get to some of our larger sites. So we thank you again. We stand ready to help.
Thank you all very much. And just so that everyone knows, this is just one example of what the vehicles will look like. All of our partners have vehicles that are similar with a similar function. As equitable distribution remains our top priority, I am confident that this mobile strategy will help us reach Baltimoreans as we continue through our vaccination efforts. And as some of you may have seen this morning, I sent a letter to Johnson & Johnson requesting partnership to directly purchase 300,000 doses of the vaccine manufactured here in Baltimore to help ensure equitable vaccine distribution to our residents. We know that to to effectively combat COVID-19, we need a greater supply of vaccine and a focus on equity. We must develop a model for distribution, focus on efficient and accessible vaccination strategies that put equity and harm reduction at the forefront of policy and planning operations. Due to inadequate supply, we know we are struggling to distribute the vaccine to our residents in a swift and equitable way that we must do it in order to combat this deadly virus. To date, nearly 44,000 first doses have been administered by a combination of the Baltimore City Health Department and our 11 hospital partners here in Baltimore. But unfortunately, due to prioritization dictated to us by the state and the extraordinary low supply of vaccines supplied to the city, only 3.4% of black residents have received their first dose of the vaccine, and that's just simply unacceptable. Of those doses that have been delivered by healthcare providers in Baltimore, less than 20% have been distributed to the city's health department, giving the city a very limited ability to improve this disparities. I want to thank our health department and all of the people working tirelessly to ensure Baltimore residents are vaccinated as quickly as our supply allows. But we see in these numbers what is needed. What is needed is the supply. I want to thank Johnson & Johnson for selecting Emergent Biosolutions to manufacture the life-saving vaccine here in Baltimore City. Emergent is and remains a strong partner to the city of Baltimore, and we are proud of its role in fighting this pandemic. I believe that through this proposed partnership, Johnson & Johnson and Baltimore City can show a commitment to equity and efficiency in vaccine distribution in a way that is unprecedented across the U.S. We have the opportunity here to focus on equity by ensuring distribution to black and brown communities that have been historically underserved by Big Pharma. And with that, we'll take a few questions.
Good afternoon, Mayor Scott. I just have a quick question about the Johnson & Johnson proposal. I'm just curious if you've had previous conversations with Johnson & Johnson that would sort of indicate a partnership like that is likely to take place. Obviously, I'm sure there have been prior conversations about emergent biosolutions and stuff like that, but wanted to ask about any prior conversations.
This is about doing what's right and what's needed for the city, and we're just very hopeful that Johnson & Johnson will realize where we are right now and where we are as a country, as a city, and do something that will benefit a city in which they are producing their vaccine. Thank you. Alexa?
Quick follow-up to that. How confident are you that that could happen? What's the likelihood? Do you think it could happen?
Well, we don't know, Alexa, but this is, you miss 100% of the shots you don't take. This is about doing what's right for the residents of Baltimore City, and this is why we decided to do that. And what we're hopeful for, and we know that there's other barriers that we will have to cross. We'll be talking to our federal partners about those. What we're hopeful is that Johnson & Johnson will recognize that they are making this vaccine here in Baltimore, and it would be a shame if the Baltimoreans didn't directly benefit from it.
Can I get a comment for you on the officer who was in field training, now facing assault charges? How will the city continue to build public trust following an incident like that?
Well, again, I think let me first thank the police commissioner and his team for immediately moving to have that officer or probationary officer terminated. It goes to show that you heard that from us. Typically, you guys in the past, you will be bringing that to us saying, oh, this happened this weekend. No, we told you that this person was removed because that's how you build trust, through transparency, through swift action. We're going to continue to make sure that we're reforming our department through the consent decree, through the efforts that we have going on in Annapolis, and we're going to build trust by working directly with the community and taking action when we see things like this.
Thank you.
Well,
Mr. Mayor, given the issue with supply and now with this rollout, what would you tell citizens who are having trouble getting appointments? The health department appointments are booked. What advice do you have to them? There's a lot of confusion as to do I wait for a van to come to my neighborhood? What would you tell the citizens who are still waiting?
Yeah, first thing is to be patient and that we're still fighting. I was on a call today, and also just to be very clear that this is not just a Baltimore City issue. I was on a call today with county leaders from the Eastern Shore and Southern Maryland who all were complaining about the same exact thing, the state's rollout and how they're doing the vaccine. A gentleman, one of our elected leaders from one of the counties in the Eastern Shore said that Walmart has gotten most of theirs, and many of them are going to people from Delaware. That let everyone know that we're going to continue to push both here, partnership with our state, but also understanding that we have a functional president now. President Biden believes that COVID-19 is real, that he's going to make sure the federal government is pushing these things out, that we're going to be ready here with our partners on the ground to get it out to people as soon as we get it.
To that point, should citizens sign up for a waiting list, or I know there's a place where you can fill out on the health department website?
Yeah, I'll let Dr. Geraza give the explanation of exactly what folks should do, especially our older adults, the folks who are most at risk, about where we are and taking the number and how we will get in contact with them.
Yeah, so specifically as it relates to older adults, we expanded something called our Maryland Access Point, which is a call-in line for older adults who either are challenged to navigate the online registration system or just don't have support to navigate it. They can actually call in and pre-register. They can be put on a waiting list for a vaccine appointment. We've been given directives at the local health department to prioritize older adults, homeless, as well as educators. And so that's generally where our focus has been. Just a reminder that this month, for the month of February, our current vaccine pod is only doing second doses. But again, individuals can call into that MAP call line, 410-396-2273, if they're older than 65 and need support pre-registering for a vaccine.
In relation to the 50 to 100 vaccinations by this mobile unit, can you talk about the allotment? How much do you have kind of on hand, and how is that either being divvied out, or how are you selecting these nursing homes that you spoke of during the presser?
Your question for me one more time. I heard bits and pieces.
Sure. With the 50 to 100 vaccinations, how much does this mobile unit have in stock right now currently?
Yeah, so again, we get notified of our allocation from the state sometimes a few days before we actually get it. And so we're making decisions internally based on that prioritization that I mentioned, specifically older adults, in this case with the focus on senior housing sites. And then based on what we've been notified we're getting from the state, then we're able to allocate to our partners to perform those vaccinations. Again, typically it's been about 50 to 100. Obviously, we hope to see that number go up as actual quantity goes up, but it will vary from week to week based on what our allocation from the state is.
So there's no number, though, because I know you mentioned that you're going to 2 this coming week, correct? Do you know how many doses you have?
So for those individual sites?
Yes.
So we'll give 100 for those individual sites as well.
And then in relation to the nursing homes, how are you selecting these that you're going to at the mobile unit? Have they already been pre-screened?
So again, our nursing homes were part of the Federal Pharmacy Partnership, but we know that even when the Federal Pharmacy Partnership came in, they didn't necessarily vaccinate every single resident of the nursing home or every single staff member. So we're going back through that list to understand who may still be unvaccinated, and we're going to select based on who is still outstanding and has not yet been vaccinated through that partnership.
While also taking into, I'm guessing, because you said equitability, their race and their neighborhoods?
Yep.
Thank you, Lowell.
Just real quick, just had a question about outreach. I know in past news conferences you've mentioned that there's been some trust issue with the vaccine in a number of the neighborhoods that you're targeting. Will these mobile units and the staff that will be there, will they help in this effort for the outreach to get people to trust the process?
Well, I think this is a part of it, but you'll hear from us very, very quickly in the next few days about how we're going to roll out even more, build more trust building. I know that that's something we're going to continue to do. Again, this is about not just when you're talking about building trust for folks who may have vaccine hesitancy, it's greater than our health partners, right? They're doing their portion. They're going to help with that. They continue to do that. But we'll be partnering the health department of the city about targeting and working with credible messengers to get in the community to make sure that we're getting a message out from every standpoint.
Thanks.
Thank you, everybody.
Thank you.
Just that.
In relation to just your press conference last week about the partnership, we noticed some of staff members and city council members, they had a brown bag with them. Can you explain what was in those bags, and were those gift bags?
A brown bag? What brown bag?
A member of your staff did not receive, or did you walk away with any gift bags or anything to that nature?
Dave, you're asking a question about, we had multiple press conferences last week.
It was the one on Wednesday when you talked about the downtown partnership to advance black businesses in the downtown corridor. One member of your staff and a city council member as well walked away with brown gift bags. I inquired and I'm asking, Did you receive one? Any member of your staff, did they receive them, and what was in them?
Yeah, so as you should know, we put those things on our ethics sheet. You will find a sheet for that, which includes a face mask, a face mask that'll be on our ethics sheet for next year because this one has already been filed. Anyone that you should know about me, you should look at my history. My ethics sheet is always going to have lots and lots and lots of things on it because when things get given to us at an event like that, we're going to report it and do the legal thing. Thank you.